We do have a copy of our report that Sheriff Brown's going to talk about called The Changing Overdose Crisis in Santa Barbara County. I'll provide each of you with a printed copy of that, and it will be on our website here shortly. With that, I now give you Sheriff Bill Brown.
Thank you, Raquel, and good afternoon, everyone, and thank you for joining us as we officially launch Project Opioid Santa Barbara County. Project Opioid is a local initiative that brings together key leaders from local government, law enforcement, the education community, the medical community, the treatment community, the business and corporate communities, and the philanthropic community. And we are joined here today by some representatives of the coalition who are coming together to tackle the perplexing problem of the abuse of opioids and the related increase in deaths that is occurring in our county. We've come together because we want to do something about it. We want to do something that is going to save lives. And this project, Opioid, has been successful in other communities, and we're bringing it here to our county. I want to introduce, and later I will ask them to come up and speak, a number of key leaders who are here who represent the various communities that I just mentioned. With us today are Lompoc Mayor Janelle Osborne, Dr. Scott Whiteley, the Executive Director of the Council on Alcoholism and Drug Abuse, CADA, John Doyle, who is with the Santa Barbara County Department of Behavioral Wellness, Be Well, Kristin Flickinger, who is the Executive Director of the Pacific Pride Foundation, Pastor Bernie Fetterman of the Lompoc Foursquare Church, Dr. Paul Erickson, the Medical Director of Psychiatry and Addiction Medicine at Cottage Hospital, John Sabinach, the Assistant District Attorney, Police Chief from Lompoc, Joe Mariani, and we also have retired Superior Court Judge Rogelio Flores, an expert in his own right, and former lead in our county's drug and veterans courts. Project Opioid originated in Seminole County in Florida. It has since been adopted by several other counties in central and southern Florida. I first learned about Project Opioid from my Major County Sheriffs of America colleague, Sheriff Dennis Lima of Seminole County. And I quickly realized the benefits of this project that forms a local coalition to approach the terrible problem of overdose deaths, and decided that we needed to bring this concept to Santa Barbara County. I am pleased to say that we now have more than 30 key leaders in our community who have been meeting regularly to develop a comprehensive plan on how we address the opioid epidemic from both the supply and the demand sides. Santa Barbara County is the first county in California to use Project Opioid. Some background on the crisis. The opioid epidemic has been growing since the 1990s, and it has occurred in three distinct waves. The first wave was driven by the overprescription of opioid medications. And this is the wave that you may have seen in the series Dope Sick, and this was what constituted the settlement with pharmaceutical companies for the distribution of drugs in our communities on a widespread basis with downplaying their addictive qualities. And there's been legal settlements for that as a result of the first wave. The second wave was caused by the stricter laws and controls over prescription opioids, but caused opioid addicts to seek out street-level illicit drugs such as heroin when they could no longer source opioids through prescription. And the third wave began in 2013, and it's known as the rise of synthetic opioids. And at the forefront of those synthetics is the drug fentanyl. Fentanyl is a drug that is 80 to 100 times more powerful than morphine. Some national statistics to frame what we're about to tell you about Santa Barbara County. The Centers for Disease Control and Prevention estimate that over 107,000 people died in the United States last year, 2021, as the result of a drug overdose. 107,000 people. This marks the largest number of drug-related deaths ever recorded in a 12-month period in our history. And to put that loss of 107,000 people into perspective, consider this. During the 10 years or so that the United States was actively involved in the Vietnam War, we lost approximately 58,000 American lives. Last year, we lost almost twice as many as that in a single year here in our homeland to drug overdose. 75% of those overdoses across the nation involve opioids, and 64% of the overdose deaths involved synthetic opioids like fentanyl. Synthetic opioids, such as the illicitly manufactured fentanyl, remain the primary driver of the increases in drug overdose deaths in our nation. Criminal drug networks in Mexico are mass-producing illicit fentanyl and counterfeit pills pressed with fentanyl in filthy, clandestine, unregulated super labs. These fake pills are designed to look like real prescription pills, right down to the size, shape, color, and stamping. And on the graphic that we have over here, you can see 2 oxycodone pills, one a legitimately manufactured pill and the other a counterfeit pill, and they are virtually identical. There is virtually no way to tell the difference of them. And in fact, in some cases, I've seen photos where the counterfeit looks better than the actual original medication. More than 9.5 million counterfeit pills were seized nationwide in 2021, which is more than all that were seized in the last 2 years combined. 40% of the fentanyl pills that were seized by the DEA last year have 2 milligrams or more of fentanyl in them, an amount which is considered a potentially lethal dose. To give you another visual look at how small that is, on the same graphic, you can see a pencil, and on the lead tip of the pencil is a tiny amount of crystallized powdered fentanyl. That is a lethal dose for a human being. That is how powerful this drug is. In California, the statistics are equally staggering. In 2020, there were 8,894 overdose deaths in our state. 5,502 of those overdose deaths were related to opioids, and 3,946 of the overdose deaths were related to fentanyl. So who are the people that were dying? They were people from across every racial and socioeconomic group that you can imagine. The majority of people, 53.5% in California that died in 2020 were white, 29.3% were Hispanic, 4.1% Asian, 11.9% African American. Fentanyl was listed as the cause of death in 77% of the fatal overdoses that I just told you about in California. Now, let's take a look at our local statistics here in Santa Barbara County. Countywide overdose statistics have increased substantially over the last 5 years. In 2017, we had 74 overdose deaths in Santa Barbara County. In 2018, that number went up to 85. In 2019, it went to 96. In 2020, it went to 114. And last year, 2021, the record number of deaths in our county, 133. The data from our Coroner's Bureau on overdose victims shows that in our case, there is a similar breakdown, although there are some differences. 57% of the people that died in our community were white. That's higher than the state average. 36% were Hispanic. That is also higher than the state average. 3% were Asian, 2% African American. The age ranges ranged from 15 to 24, 19 of those deaths, but the largest number were in the middle. 25 to 44 had 55 victims. Age 45 to 64 had 50 victims. And 9 of the victims were 65 years or older. How many of those deaths involved fentanyl? In 2019, it was 36 of the deaths That's 37.5%. In 2020, 36 of the deaths, but a higher number, a lower percentage, 31.6. And in 2021, 67 of those overdoses involved fentanyl, 50.4%. Lower than the state average and the national average, but still unacceptably high and an incredible danger to our community. Today's launch of Operation Opioid centers on the release of a report called The Changing Overdose Crisis in Santa Barbara County. The report chronicles some disturbing information about the extent of the opioid problem in California and specifically in Santa Barbara County. The report was authored by Dr. Kendall Cortelyou with the assistance of our agency. Dr. Cortelyou is the Director of Data, Analytics, and Strategy with Project Opioid, a nonprofit organization committed to empowering the local government, business, and faith communities to make a difference in the opioid crisis. She is also an associate professor and program director from the Healthcare Informatics program at the University of Central Florida. I will now turn the podium over to Dr. Cortelyou to share some of that report's data with you today.
Thank you. Thank you very much, Sheriff, and thank you all for having me. So as Sheriff Brown mentioned, I authored a report that you will all get a copy of. And what this really does is it looks at how the crisis has really changed and evolved. And some of the data that Sheriff spoke about, first is that overdoses are increasing across the country, across the state, and in Santa Barbara County. So if you look back over the lifespan of when we started tracking these numbers, overdose deaths in in California are up 150% around since 2015. So that's a dramatic increase in the number of people that are overdosing and dying in this state. In Santa Barbara County, as Sheriff mentioned, those numbers are increasing as well, and we are really seeing a very widespread increase in the number of overdose deaths. And then in addition to that, fentanyl, just as Sheriff said, has really infiltrated the drug supply and has really changed the game in terms of overdoses, who's dying, how quickly they're dying, et cetera. Some interesting facts when you look at how fentanyl has impacted this community in particular. In the fentanyl deaths that Sheriff referenced, over 70% of those are people 40 and younger. So we're really talking about fentanyl impacting our youth, the millennials, the Gen Z population. So this is an entire population that's really being impacted very heavily by fentanyl. And those numbers are very consistent with the rest of the country. So fentanyl has really changed the game in that way, and it's being combined with a lot of other drugs. As Sheriff mentioned, the pills that we see here, sometimes people don't know that they're taking fentanyl. People don't know what they're taking. We have seen fentanyl pressed into pills made to look like Oxy 30s, made to look like Adderall, made to look like Zoloft. There's a number of prescription pills that people take routinely that now are just illicitly manufactured fentanyl. So there's a lot of things of worry that comes with that as well. We're seeing fentanyl being put into cocaine. And that is scary, for one, because fentanyl is so dangerous, but fentanyl actually also increases the lethality of cocaine. So in Santa Barbara County, we saw the vast majority of people dying with not just one drug in their system, but at least two drugs. Fentanyl mixed with methamphetamines, all kinds of different combinations. So it's really important for the community to understand that their drugs may or may not be what they think that they're taking. So that's a really important finding from this report. Another one is that we have seen some changes in the demographics. If you look back over the years from between 2015 and 2021, there's been a dramatic increase in the overdose death rate among the Hispanic population in Santa Barbara County. So we're not sure what that's attributable to, but it's definitely something that needs to be addressed. And I really commend the sheriff and everybody that's here with us today for stepping up and to the plate and forming this coalition to address the opioid crisis in Santa Barbara County. Sure.
Thank you, Dr. Corlew, for your work in this arena and for helping us as we put together Project Opioid Santa Barbara County. I'd like to now call up some representatives of this wonderful coalition that we have formed and ask them to say a few words about it and about where we're headed, our work together. And I'd like to start with Lompoc Mayor Janelle Osborne.
First, I want to thank you, Sheriff Brown, for identifying this issue and bringing it to our attention. If we hadn't been shown the data that you've collected and the work that you have put forward, we wouldn't have had a true understanding that it's not just my community and it's not just Santa Barbara County, that it is the entire state and national epidemic. I also want to thank all of the individuals that have been attending these meetings, from the nonprofits to the service providers to the elected officials and to our county representatives. If we don't come to the table and discuss this, we won't be able to tackle this in a broad enough way that we cut back on what's happening. So moving forward, we've identified the issue. We've identified how it's occurring and what we can do to address it. We've identified the resources that are out there. Moving forward, Project Opioid is going to give us the opportunity to advocate and educate our communities on what those outlets are that you may need, whether it's your child that is experiencing an addiction, whether it's you yourself or a family member, or it's an associate that you work with or volunteer with. We're going to coordinate what those recovery systems, rehabilitation, treatment systems are, and provide that to the community in a unified way. So we're now introducing this to you, our public, and we want to hear back from you. So as your elected official and one of those on this team, I want to hear from you about what your needs are, what you need to know about this, so that we can add that to those resources. And we're looking to form that support that you all need, that we all need, in order to address the fact that fentanyl is driving the overdose in our communities, and we need to reduce that impact and try and address this issue. So thank you again, and thank you to all my partners.
Well, thank you, Mayor Osborne. Next, I'd like to introduce Dr. Scott Whiteley. He is the Executive Director of CADA, the Council on Alcoholism and Drug Abuse, an organization that's been in existence in our county, working on problems of addiction and substances for 70 years. Dr. Whiteley.
Thank you, Sheriff. There's the old adage that it takes a village to raise a child, and I think to address this problem, it's going to take a dedicated community to collaborate and fully engage with not only the foundation of the problem, but also the treatment of the problem. We have many, many treatment providers, really good treatment providers. My agency is one of them, but I have other fellow agencies that provide wonderful treatment for drug abuse, for alcohol abuse, for any substance abuse. But treatment alone is not going to be sufficient. It's going to take many other efforts, and efforts from a committed group like this of elected officials, of policymakers, of treatment providers, of educational and institutional resources to really fully deal with this problem. So I congratulate the sheriff on sponsoring this, on convening it, and supporting this group. And I think I speak on behalf of all of my fellow treatment providers in that we're fully committed and will support this effort to the full extent. So thank you again, Sheriff.
Thank you, Dr. Whiteley. And also representing the treatment community and the prevention community, I'd like to ask John Doyle from the Department of Behavioral Wellness for the County of Santa Barbara to come up.
Thank you, Sheriff, for your leadership in this. The beauty of Project Opioid is bringing together all of the work that all of us have been doing. The County of Santa Barbara has a rich milieu of prevention and treatment services. We provide safe prescribing practices led largely by doctors like Paul Erickson of Cottage Hospital. We have a great deal of Narcan distribution. Here is the Narcan, which is the antidote to an opioid overdose, and we have widespread medication-assisted treatment. The beauty of Project Opioid is that it is an organization led by Sheriff that is going to really coordinate all of the wonderful services that we have. So on behalf of the county, Sheriff, Behavioral Wellness, thank you very much for your leadership.
Thank you, John. Thanks for being such a great collaborative partner. Next, I'd like to invite Kristin Flickinger, another great collaborative partner. She's the executive director of Pacific Pride Foundation that has a long history of being at the forefront of distributing Narcan, this life-saving narcotic antagonist that can reverse the effects of a narcotics overdose.
So since 1976, Pacific Pride Foundation has been dedicated to ensuring a vibrant, thriving, and visible LGBTQ+ and HIV-impacted community. And since the beginning, providing services for people who use drugs has been part of the services that we provide. And for nearly 30 years, we have provided syringe exchange services throughout Santa Barbara County, the only organization to be able to do those types of things. And part of those services include a partnership with the County of Santa Barbara to distribute the opioid overdose reversing drug Narcan as widely as possible, as well as to distribute fentanyl test strips that can allow people who use drugs. It can allow people who use drugs to test their drugs and avoid fentanyl poisoning. We are very proud to be standing with this group of people and Project Opioid, as well as the Sheriff. Thank you for having us and bringing us together. And we remain dedicated to providing services for this county that will strengthen the health and wellness of our communities.
Thank you, Kristin. Next, representing the faith-based community, I'd like to introduce Pastor Bernie Fetterman from the Lompoc Foursquare Church.
Thank you, Sheriff, for allowing the faith-based group to have a seat at the table. Oftentimes when we lose someone, we hear the statement, "You're in our thoughts and prayers." I think sometimes people aren't tired of thoughts and prayers, but they want action. And I'm grateful that the Bible tells us faith without works is dead. And we're working together across the table, across the aisle, across our county to say, how can we save lives? One more lost life from an opioid overdose or a fentanyl overdose is one too many. So I'm honored to work together with the faith-based community and Sheriff Bill Brown and this awesome team to see that people are educated, people get the services they need, and that we don't lose any more lives. Thank you very much.
Thank you, Pastor Fetterman. Next, we have Dr. Paul Erickson. He is the medical director of psychiatry and addiction medicine for Cottage Hospital, representing the medical community.
Thank you, Sheriff Brown. Cottage Health and Cottage Hospital are very pleased to be part of the Project Opioid work. We are doing our best at the hospital to address the opioid problem, starting with education and early intervention, as well as providing clinical services. We've worked in partnership with community organizations such as CADA and the neighborhood clinics and county alcohol and drug services and others. But I think now Project Opioid is broadening and deepening the community coalition that will address this problem. And it takes all of us from many different parts of the community to work on and make progress with this problem. So we very much appreciate the chance to now be part of a very cooperative group to work together across the community to address the problem.
Thank you, Dr. Erickson. Next, I'd like to introduce the Assistant District Attorney for Santa Barbara County, John Sabinach.
Thank you, Sheriff Brown. Thank you for bringing this group together. Project Opioid is about saving lives. You see before you a number of members of the law enforcement community. I myself, representing District Attorney Joyce Dudley here. This is not about prosecuting addicts. This is about saving lives. We have in the works some efforts to go after distributors who distribute fatal narcotics, but that is separate from this organization and what we are doing here today. Today is about bringing about everybody. Those of us in law enforcement, we see the aftermath. We deal with the victims. We talk to the parents. The deputies and officers are confronted with the decedent. We feel the emotion of this, and we want to be a part of the solution. So thank you, Sheriff.
Thank you, Assistant DA Sabinach. Representing the law enforcement community here today, the police chiefs of Santa Barbara County, I'd like to introduce Lompoc Police Chief Joe Mariani.
Thank you, Sheriff. When you look at this problem and the gravity of it and the fact that oftentimes we're the first, meaning law enforcement, to have to deal with the aftermath of this, we're also smart enough to realize that we can't address this problem by ourselves, and it involves more than enforcement. And I'm so happy and proud to be a part of this collective group that really wants to make a difference and understands that the priority is saving lives. And I want to thank the sheriff for being the catalyst, because when he first approached us in our county law enforcement executive meeting about this idea, we eagerly, unanimously decided to stand behind him and be a part of it. So thank you again, Sheriff, for your leadership.
Thank you, Chief Mariani. And last but certainly not least, I'd like to ask Superior Court Judge Rogelio Flores to come up and give his perspective.
First of all, I want to thank the sheriff for asking us all to join Project Opioid. This is one of the most important projects in the history of this county. Let me remind the viewing public and the listening public that these people who have died of an overdose are somebody's son, somebody's father, somebody's brother, sister, mother, somebody's parishioner, somebody's friend. These are human beings that have died. And we have to find a way to reduce these numbers. And the only way we know how is working as a community and pulling in the same direction to help these folks regain their life from this addiction and substance abuse. We're pulling ourselves out of a long and drastic pandemic, and it's been painful. But one of the reasons why we've been able to pull out of this is because there's vaccines. There's no vaccine for opioid addiction. The only thing that's going to work is community education, treatment, recovery, treatment including substance abuse treatment, medically assisted treatment, recovery, and mostly the love of this community for those people who too many times know no love at all. But the task is monumental. Either we put a stop to this now and start reducing these numbers, or we're going to see too many friends and family suffering from death, and not only death, illness, misery from opioid addiction. So let's pull together, Santa Barbara County. Let's work together to make a change for the better. Sheriff, you and your team have done a remarkable job, and I look forward to this continuing collaboration. I look forward to making a difference in this county that I love so much. Thank you.
Thank you, Judge Flores, and thank all of our speakers today for their perspective on this wonderful program. So I want to conclude things here by saying a couple of things. First of all, I want to particularly thank Dr. Kendall Cortelyou for putting the report that we have launched today together in record time and in coordinating us coming here from Florida to work with us to develop our local plan on how to address this vexing crisis. This report that we have launched today can be accessed at the Santa Barbara County Sheriff's Office website. That's www.sbsheriff.org. We will also distribute it to other outlets as well. We want it to be as widely available to the community as possible. Today's public launch of Project Opioid and the release of the report you just heard is our first step in addressing the tragic problem of overdose deaths. And I can guarantee you, we are just getting started. In the near future, we will be back to you, to the public, to disclose other elements of our plan to combat the opioid crisis in Santa Barbara County. These elements will include expanding Narcan availability and distribution within Santa Barbara County. This wonderful drug, Narcan, that has the ability to reverse an overdose and save a life if it is administered quickly enough. We want to get this as widespread throughout our community as possible, and our vision is that one day you will walk into a public area or a public building like this, and just like seeing a fire extinguisher on the wall, just like seeing an automated external defibrillator on the wall, you'll see Narcan on the wall, available for people to use in the event that someone is unconscious, still alive, but suffering from an overdose death and destined to die if there's not some intervention. The use of Narcan has saved many lives, and it has the potential to save many, many more, and we see this as the lowest hanging piece of fruit on this tree to be picked. We will also begin an education campaign, a public campaign for community members and young people that focuses on the dangers of fentanyl. We will coordinate and collaborate with our local and federal law enforcement partners to step up the narcotics enforcement that targets those people who sell and distribute fentanyl in our communities, this poison in our communities that is being distributed. Let us put you on notice right now. We are coming after you. We are not going to tolerate the current situation where this deadly drug is peddled to the degree that it is here in our community. And we will be working collectively to go after and target those who sell and distribute this drug. We will enhance awareness of the fine work that's being done in the Santa Barbara treatment community and work to expand the capacity of treatment programs in Santa Barbara County, both residential and community-based treatment programs that are so essential to helping people with a substance use disorder regain a clean and sober and safe lifestyle. We will begin following up with victims of near-fatal overdoses, and we will be offering them services, seeking them out, those whose lives have been saved by the Narcan, to be able to make sure that they are offered and give them every opportunity to get into services to help them. And lastly, we will work diligently to reduce the stigma of addiction and send the message that collectively we are deeply concerned for the safety of those who are abusing drugs in our community and that help is available, that we have an incredible number of resources here in Santa Barbara County that, if utilized, will save lives and help people turn lives around. And I think the message that you've heard from all of the people who spoke today is simply this: none of us who are up here today can solve this problem on our own or through our agencies that we represent. But collectively, by combining forces, by combining resources, by working together to combine budgets, by working together to put shoulders to the wheel, we can tackle this problem and we can save many, many lives in Santa Barbara County. That will conclude the prepared remarks today for this press conference, and we would be happy to answer any questions that you have, or if you'd like any interviews afterwards, we're happy to stay for that as well. So thank you for being here today.